going on, guys? Jason here, and today I'm actually enjoying a beautiful day at the Outer Banks in North Carolina, and everything's been perfect except for one little thing, and that's this thing. I don't know if you can see this. Aphthous ulcer. So I get these occasionally. They're a pain in the neck. Most of the time I notice I get them more if I'm eating like dairy products, milk, cheese, those sort of things. There's actually an interesting article that came out last year that linked Aphthous ulcers to cow's milk protein, and I did a whole video on that on the website comprehensivedentist.com. So one of the things I wanted to talk to you about really quickly is the product called Debacterol. Okay, so this is Debacterol here. I use this pretty frequently for myself and for any patients that happen to come in with canker sores or Aphthous ulcers. And it's really kind of a cool product because it's really simple to use. You can literally treat the patient. It would take less than probably 3-4 minutes to actually do this. There are some different things you need to know about the product though. It smells awful. Even just holding this right now, you can smell the medication. It's very potent smell. It will stink up the entire room. Essentially when you use this, you're basically doing chemical cautery. So this has sulfuric acid in it, and it burns like crazy when you apply it to the ulcer. This comes with a little Q-tip here that's just a dry Q-tip, and basically you're going to take this out and you're just going to dry the ulcer. Next thing you're going to do is you're going to open this one here. This is like a Q-tip, but the medication's actually in here. And so what you're going to do is you're going to break this off and you're going to allow the medication to drip down to here. They say apply the affected area for 5 seconds, and then you're going to rinse it with water. Now sometimes I'll do a second application, especially if I feel like I didn't get it very well the first time. Let's go inside. Let's actually use this on my ulcer, and then we'll see how it looks afterwards. Alright guys, we're in the bathroom now. So I'm going to go ahead and treat this. I'm treating myself, so I'm not wearing gloves or anything like that. Obviously, if you do this chair side. Don't take the patient into the bathroom. That would just be weird. Wear gloves, and also have some water available. As I mentioned earlier, first thing we're going to do is we're just going to dry the area with the Q-tip. Keep in mind I'm doing this through the camera, so it's a little bit hard to see. So again, when you use this, just break the top, just like so. You'll see that all the medication will start to drain down into the base of this. And once it starts to drain into there, the end of this gets pretty wet, so just keep that in mind. All right, so I got that ready. Here we go. Just gonna dry this. Oh, that definitely hurts. Okay. All right, here we go. Oh, it stings so bad. Patients are not gonna like this. And I would warn them that it's gonna sting. Honestly, you can't really prepare yourself for it. I think when you do it to yourself, it's way worse because you know it's coming. I'm just gonna do one application. This ulcer's been here for probably about 5 days now, so it ideally should be on the mend. The other thing I would mention is when you do purchase this, you wanna purchase this through an actual dental company. We normally order our products through Henry Schein. They carry that in the catalog. As long as you're a licensed provider, you can order this, so it shouldn't be a problem. If you want to, at this point, I could actually do a second application with the same Q-tip. I'm gonna show you a picture of what it looks like after I treat it, because it's gonna look a lot different. We'll do a before and after. Another thing I would mention though is initially it's not gonna feel perfect, or it's not gonna feel like the pain's completely gone. It actually kind of makes the pain worse for a little bit. But then as it settles down over the next few minutes, the pain will typically go away. But the big thing is normally an Aphthous ulcer is going to bother you more during function. So when you're eating, I should see a noticeable difference when I'm eating, talking, etc. It's already starting to feel a little bit better. So if you have any other questions about this stuff, just put them in the comments down below. I know this is kind of ad lib, but you get the idea. You see the product. Definitely check this out for your patients. I think you're going to like it. If you like this video, hit that like button. If you haven't subscribed to the channel already, please go ahead and do so. And we'll see you next time. Thanks.